think tank presentation. Then we'll hand it over to you guys, Rowan and Stephanie, and we'll hear from you about SNAP for seniors in South Carolina. So we're looking forward to hearing from you guys, and then we will have some time after your presentation for the whole group to discuss what they heard, talk about any ideas that were generated, and that'll be it. So thank you all again for your time this morning, and I'll hand it over to you, Lori.
All right, well, I'll go through this quickly. Some of you have been on all of our calls so far, so this may be a repeat, but we know in the world of health education, repetition is not a bad thing. So welcome to our third think tank presentation. This morning, we're going to be talking about SNAP specifically for seniors. And so that's what we're going to focus on today. And it's just to give an opportunity for the Healthy Palmetto Leadership Council to hear directly from our South Carolina Department on Aging, as well as South Carolina Thrive, because they are the state leaders working on this identified priority. And then we'll have time, like Kelsey said, to discuss how the Leadership Council can help to advance these priorities in the state. And so just a little reminder, we are going from a state health improvement plan, which is from 2018 to 2023. Within that, one of the 5 top priorities was chronic health conditions, and really needing to put some focus and effort in our state on this. And so there were goals and objectives that were set in our state health improvement plan related specifically to chronic health conditions. And Healthy Palmetto has been coming together since the beginning of 2020 to be the state coalition of organizations that's really focused in on those healthy eating, active living, and healthy weight portions of our state health improvement plan. And so our role is to unify and mobilize healthy eating and active living efforts that create equitable opportunities for all South Carolinians to achieve a healthy weight. So we are not an implementing body, just to remind everybody. We're here to unify, mobilize, connect, and as I said before, to advance what's working well in our state. And so the objective we most closely align with is to decrease the adults who are obese in South Carolina, trying to get down to 31.5%. And it is our role as a leadership council to monitor this over time. So when new data comes out, we take a look at it and see where we're going. The 2021 data that just came out in September 2021 shows that we're at 36.2%, so definitely going in the wrong direction, which means we do need to put more focus and attention on these efforts. And in South Carolina, we have a unique data set from the South Carolina FitnessGram system that gives us a view of what's happening with our children's health-related fitness, which then can be an indicator of what's going to continue to happen in our adult population. And so we, over the last year or so, have been looking and taking a deep dive into the Trust for America's Health State of Obesity recommendations for states. And although there's a long laundry list of things that states should be doing to change the tide of obesity, we have narrowed the list down. And so when we left our December meeting, we had narrowed that down to 13 different priorities that we wanted to try to advance in South Carolina. And Kelsey and Landon and I have been meeting with those state leaders, and 5 of those decided not to go forward and receive the assistance that we were offering from Healthy Palmetto. We will talk about that more in detail at our February 3rd Leadership Council meeting. But the ones left in white are the ones that we're going forward with, and those that we're hearing from last week and this week. And so we've got 1 in early care and education, 1 in schools, 2 in the physical activity and built environment category, 1 remaining in healthcare system. We just heard from WIC in nutrition education, and we will be hearing right now from SNAP, specifically seniors. And this is one that Cherie from AARP brought up when we were narrowing down our list. Let's not leave out our seniors. And we're so glad she did that, because now we've got this presentation today that really is focused on seniors and making them, those that are eligible, making sure they're aware of the SNAP program. And so this is our presentation schedule last week and this week. We are currently on our 3rd one. And so in just a moment, I'll be turning it over to Rowan and to Stephanie to talk about SNAP for seniors. And then, just like I'm always saying, just repeating it one more time, put on your Healthy Palmetto Leadership Council hat. And so think about this as, how can we collectively as a unit advance what they're sharing with us today? How can we help them together, as well as just putting on your organizational hat, not just your position, but how can your organization actually help further these initiatives as well? And then we all serve on task forces, committees, coalitions. So don't leave out that part of your role as well when you're thinking about this and the connections that we can make. So as they present, please be thinking about what are you still curious about for SNAP and seniors? And then what ideas does this generate for you thinking about all the hats that you wear? So without further ado, I'm going to stop sharing so that Rowan and Stephanie, you can share your slides and let us have it. Welcome.
Thank you so much. And so I guess we've already been sort of introduced already, but just by way of introduction, my name is Stephanie McGuire. I'm the Chief Marketing and Training Officer for SC Thrive. And I'm excited to be here this morning and to share this opportunity to share what we're currently doing in the state around senior and SNAP. And I'll turn it over to Rowan.
Good morning, everyone. My name is Rowan Goodrich, and I am a registered dietitian with the South Carolina Department of Aging. And I'm just pulling up my presentation, so give me 1 second. Okay, can everybody see the slides? All right, wonderful. So just to give you a little bit more information about my role within the Department on Aging, I actually oversee 2 different programs of the Older Americans Act, and those would be the Title III-C programs, which most commonly referred to as home delivered meals or congregate nutrition program. And then I also oversee Title III-D of the Older Americans Act, which is not 3D glasses, but it's evidence-based programs for health promotion and disease prevention. And Stephanie and I thought it would be a good idea for me to give you a little general overview of the Department on Aging and kind of where we fit in within the South Carolina Aging Network. To give you kind of a broad idea of what we do, and then specifically what we do as it relates to nutrition programs. So South Carolina Department of Aging is the designated state unit on aging for South Carolina. Other states may call themselves other things like councils on aging or offices on aging, but we're the Department on Aging. And we are overseen by the Administration on Aging at the federal level. And we actually get different grants, federal grants to provide support and services for seniors to age healthfully in place. Our state is broken up into 10 area agencies on aging. So you can see that map there on the right of how we are broken down into 10 different regions and the different counties that make up those regions. And in each of those regions, there are basically, it's like a resource hub, basically. That's where the work is really done on the local level to really help seniors in the communities. And the types of supports are all a little bit different because every region is a little bit different and the needs might be different in each region, but generally we're looking at the Older Americans Act programs for our in-network programs. So again, the nutrition programs I talked about, evidence-based programs, but also transportation is another program, employment opportunities for seniors, and other things of that nature. Even minor home repair might be a program that a region is doing. So lots of different things. We don't means test, and the majority of the services that we provide are for 60 and older, but there are some programs that are maybe 55 and older. So as far as senior SNAP, our process for assisting seniors with the application process varies by region, just because each of the regions is very different. The staffing is different. The structures are just completely different depending on the resources they have. But again, these are the 10 area agencies on aging in the left-hand column, and the different counties that make up those regions. And then in the right-hand column, you'll see some more detail about what we actually do when we assist individuals with the Senior SNAP application process. Because besides the Older Americans Act services that we assist with, we also do support seniors to other things that they may need to support their nutritional health. One of those being SNAP. It could also be assistance with connecting them to a food bank. It could be food share. It could be low country street grocery. It really just depends on where it's happening. But as far as SNAP, we have some regions that directly assist with the application process. And then we have some, which may be the old school paper method of assisting with the applications and mailing them off to DSS. We have other regions who have become more technology driven and are using SC Thrive. They partner with them, they've gone through their training, and they use their hub portal process, which Stephanie will talk about that a little bit more in a few slides or so. And in some regions, we would just refer straight to DSS for any calls we get about SNAP applications. So a lot of the work that we do on this slide is really seniors coming to us for assistance. So because of that, we wanted to really focus on how can we do more outreach and find interested seniors who would like to be enrolled in SNAP, and how can we assist them? So we did apply for a grant through the National Council on Aging, and it's actually called the Senior SNAP Enrollment Initiative Grant. And you may have heard it before. It rolls around every 18 months. It's a nationwide opportunity. It's funded by the Walmart Foundation. And we really wanted to jump in and kind of focus on SNAP enrollment initiatives, because that's not usually our main focus. And this is the first time we kind of looked at this from the state level. And we utilized the Catawba and Trident regions when we were looking at these initiatives. Trident is already an SC Thrive partner and uses the hub portal for the technology for assisting with the applications. Catawba was not using it. So this is an opportunity to kind of bring them on and see kind of how they like this whole process. The time frame, it began on October 1st, 2020, and it's almost coming to an end. But basically, the goals are to significantly increase the participation of older adults in SNAP through community-based outreach and enrollment initiatives, and I'll talk a little bit about those next. And then identifying, analyzing, and disseminating replicable, cost-effective, and scalable strategies for increasing SNAP senior enrollment. But of course, the benefit of what we do already is that we're already connected with so many different seniors, especially rural community seniors. Because even though the resource hub in each of those regions is in one location, we branch out so much with things we are already doing. And one of those things, of course, being Older Americans Act meals or the elderly nutrition programs. We're already serving group dining and home delivered meal clients. And during COVID, we had more people jump onto home delivered meal services than ever. So it was a great opportunity to start connecting them with SNAP if they were interested, who may have never had the opportunity before or weren't sure how to enroll. So a lot of the materials we used were actually through the National Council on Aging. That was part of the requirement of the grant, was to use their materials, but we could kind of plug in specific things for that area, like the phone number and maybe the area agency on aging in that particular region where we were doing the outreach. But we have had the ability to do a lot of different connections through different programs that are already going on to kind of market what we were doing. For example, the Seniors Farmers Market, which we participate within anyway. So it's another opportunity to add on the SNAP process. So I've listed a lot of different examples here. There's more than this of what avenues we used for doing our outreach. These are just some of the examples. And then some of the presentations at the bottom were part of things that are ongoing collaborations that are already happening at the local level. So this was just another opportunity to let others know what was going on, that we were helping and assisting with enrolling in SNAP, and you know, to spread the word for us. So as I mentioned, one of the things that we really focused on was using the training and technology platform of SC Thrive, just to make the process a little bit more streamlined, kind of pull away from the paper application process, and utilize this technology-driven process that you can save the applications as you get documentation for deductions and whatnot. You can upload and add all these things to the application, and then send it off straight to DSS when everything is collected and ready to go. And again, Stephanie will talk a little bit more about that in a little bit. So one of the things we were really looking at, like I said before, was focusing on who we were already serving for other services, but also getting out information through food banks and whatnot. This was English material, so we were not really targeting to Hispanic or Latino. It wasn't Spanish speaking materials, things like that. But we were looking for rural, low income individuals. And this is just basically demographic data that we were required to collect as part of the grant, just to see who we were touching and if we were bringing in basically the right individuals. So as you can see, the majority of the individuals that we have assisted thus far are 65 to 74, and then right behind that is the 75 and older, and then at 50%, 60 to 64 individuals. There's about 15% of those. For gender, we were either collecting if the individual is male, female, or other. Nobody identified as other, but we had 69 identified as female and 31% as male, which we know we're hitting again the right targets, because honestly, the majority of seniors who are still with us are female and usually live alone. Race and ethnicity, the majority of the individuals that we have helped enroll are Black, 38% are white, and then only 1% are Asian or Asian American. And we have 0% here for Hispanic, Latino, or Spanish origin. It was really 0.3 if you want to be really technical, but that's why there's still a little tiny sliver on this pie chart. For income, the majority of the individuals are between 10 to almost 15,000 annual income. As far as marital status, 39% identified as being single, 32% widowed, 14% divorced, 11% married, and 4% married living or separately. Disability was self-declared. We weren't gathering any information to verify actual disability status. That was not part of the process. We were just supposed to find self-declared information, and 87% said that they had some type of disability, and 30% said no. And then same with veteran status, 94% said that they were not a veteran, and 6% said they were. So part of the thing with the SC Thrive and just our process in general, when we assist individuals, is that we are addressing health inequities. Again, our outreach is really targeting low-income minority populations. We were really using avenues that would pull people in and going to the places where they are versus them trying to find us, because sometimes they have trouble finding us, should we say. That Thrive Hub can be assessed from any county in South Carolina. So it's statewide, countywide spread. And it screens for lots of different things. And again, Stephanie will talk about that a little bit later. Not just for SNAP, but other things that people may need, resources and things that they may need, just like our resource hubs and the area agencies on aging. We also are looking for how we can assist people. It's a closed loop referral system. It incorporates the search directory. And then another important thing to note about this whole process with the Thrive Hub is that telephone assistance can be used, which of course has been good because of COVID. We have a lot of individuals not meeting face to face, but also it helps to break down other barriers that could be seen with those trying to get application assistance. Maybe individuals who have low literacy skills, or maybe mobility issues, or maybe some transportation barriers. And even just standing in line or going to an office can be a difficult thing for somebody. So this helps to kind of break that wall down. So some of the successes through this whole process of doing the increased outreach and using the technology is that the Thrive Hub does allow that the power of technology to make everything more streamlined, but there's still that human interaction of assisting with the whole process. Of course, another bonus is that Department on Aging has really strengthened our partnership with SC Thrive. And then also other things that we are already doing help to strengthen a little bit of the nutrition supports needed for seniors, like combining SNAP assistance with other things that are already going on, like the Seniors Farmers Market, or working alongside food banks, or even working with the rural health clinics to let them know that we're helping with this process. But there are still challenges, and a lot of the challenges we're seeing are not new challenges. If you read about SNAP and the reasons people do not apply for SNAP, even though so many more are eligible, we are seeing the exact same things. We're hearing these things. One of the things is we are definitely always letting seniors know to be mindful of scams, especially telephone scams. And so sometimes that can be a little bit tricky because we're trying to do outreach to them, but it can be difficult to connect sometimes. The good thing is that SC Thrive and area agencies on aging, Department on Aging, usually we're known by name. We already maybe be connected with seniors in some aspect already, so there's trust in our name at least. Sometimes we are hearing that there's not enough of a benefit to go through all the hassle. I'm only going to get $16. Why do it again? Because they have to recertify and do all their paperwork again. But what we're realizing is that individuals who have gone through that may not have gone through the full application process and really maximize their benefit by making it known all of the different medical deductions that they have, especially if they have excessive ones. And sometimes that's just because they may not even know what counts as a medical deduction. And maybe even counselors have a little bit of a gray area there with knowing what counts as a medical deduction to help increase those benefits. So we see there's a little bit of a lack of education maybe on both sides about stuff like that. The other thing is, of course, maybe seniors don't know how to apply. We're trying to do the outreach to get to them, or maybe not knowing that they're actually even eligible. So just even the type of marketing materials that are going out there, maybe a little bit more strength is needed to help explain that process a little bit more to make seniors aware and rethink SNAP. So I'm going to hand it over to Stephanie for a little bit, because then she can dive into what SC Thrive is. Thank you, Stephanie.
Thanks, Rowan. And so Rowan did a great job at just sort of sharing what some of the challenges and barriers are, but also some of these successes through our relationship or our partnership. And so what do we do as an organization? At SC Thrive, we really help connect people to all the resources that they may be eligible for, but not receiving. And so we'll talk about sort of how we do that. We believe in helping the whole person, both physically, mentally, and financially. So we host trainings on SNAP, we do webinars, we do financial health trainings as well to help people understand how they can stretch their SNAP budgets a little bit more. And then we also provide the technology. We can advance the next slide. Okay, perfect. So some of the programs that we offer, not only SNAP, of course, we offer access to the SNAP program, but we also help seniors access other programs or benefits such as Medicaid. So Healthy Connections Medicaid, they have a program called Healthy Connections Prime for the dual eligible population that are 65 and older that are receiving both Medicare and Medicaid. And then long-term care or the supplemental programs such as Well Vista Medication Assistance Program for those who are not insured, the Medicare Savings Programs, as well as the Age-Blind and Disabled application. Next slide. And so some of the other resources, which is really a great benefit that's built in sort of into Thrive Hub, is we have a document repository where seniors can store their documents there. Oftentimes, you know, as we age, we may misplace our documents. So things such as birth certificates or social security cards, we have an application in the system where they can apply to get those documents replaced. But they can also register to vote. We have our search directory that I'll just talk about in just a second. And then for those grandparents who may be raising grandchildren, we have Help Me Grow South Carolina within our organization that helps grandparents connect their grandchildren to resources. So for example, their grandchildren may have developmental delays and they don't know sort of where to go or where to turn to help their grandchild. Help Me Grow will help them do those assessments if their grandchildren are exhibiting signs of, you know, delay, and we can help them connect also to providers there. And then we also offer military veteran resources and coronavirus resources. But as it pertains to this particular initiative, next slide, we want to talk about SNAP. And so we found that, you know, only 48% of SNAP eligible seniors are enrolled into the program. And we want to change that collectively. When we look at why seniors are applying for SNAP, we found some of those same things that Rowan discussed. You know, people say, well, $60 is not enough, right, to feed my family or to feed my household. So why I go through the hassle? We help educate seniors on the benefits of enrolling in SNAP, but they can save sort of, if they do get $16 per month, they can sort of kind of bank those resources and use some in a different month, or they can go to say Costco or Sam's Club. A lot of people don't know that those bulk organizations or those bulk stores, they actually accepts EBT or SNAP. And so being able to stretch your dollar that way can help also seniors access those resources. We do applications for SNAP, but also for ESAP. So that's for those individuals who are 60 and older who have unearned income, and then also connecting them again to resources such as Healthy Connections Prime and long-term care. So when we look in our state in South Carolina, we have over 500,000 people who are food insecure. And we want to change that. And so when we look at when a senior enrolls in SNAP, we not only just help them apply and complete their application. Of course, that application is submitted directly to DSS, but we also educate them on the additional benefits of being enrolled. So for example, like the Healthy Bucks program, where a senior could get 2-for-1 tokens to use for fresh fruits and vegetables. When we talk about healthy chronic health conditions, getting access to healthy and nutritious foods help to mitigate some of those chronic diseases such as high hypertension, high blood pressure, diabetes, things like that. So when they are enrolled in SNAP, they get those healthy bucks that they can access at farmers markets and fresh fruit stands. But not only that, we do also do outreach at the Seniors Farmers Market Nutrition Program through the Council on Aging. And so our staffs are there to help people apply right on the spot. If they are eligible, they also get vouchers to use SNAP benefits again at those farmers markets. But the medical deductions expense, I like to take a little bit of time to talk about that because I think that's one of the main areas why seniors don't enroll in SNAP. With the medical deductions expense, it really helps you to disclose all those medical expenses that you're paying out of pocket. And so if someone is paying, say a senior is paying $35 or more a month in transportation to or from their doctor, if they have co-pays, if they're paying deductibles, even if they're paying, which most are, if they're Medicare eligible, whether they're disabled or whether they're, they've aged into Medicare, where they're at 65 and older, they're having $170 taken out of their Social Security check. But many seniors are not disclosing that on their application. If they put that amount on their application, that this is what they're paying per month, that would help to drive up their SNAP benefit eligibility. And so we just educate seniors on the importance of, what are you spending every month? Do you have diabetes supplies that you're using or paying for out of your pocket? Put those on your application so then the eligibility team at DSS can make a full, complete eligibility determination. So, and then of course, we also promote some of the other programs from SNAP like Project Hope. So there are multiple ways to access our resources. One, we have a lot of information on our website at scthrive.org. But as Rowan said, we like to partner with agencies who are already serving seniors. So we have over 310 SC Thrive partners around the state. We encourage organizations who are serving seniors to partner with us. We can help them sign up for a Thrive Hub account or help that senior as well. Or they can have access to our contact center by calling our 1-800 number. So when we look at Thrive Hub really is that centralized access point for resources. It has a collaborative case management tool where not only are we screening for benefits or helping people apply, but we also can look at that whole picture of where that senior may sit. Are they food insecure? Are there gaps in transportation, or are there behavioral health concerns? Thrive Hub has all that built in where an individual can access multiple resources on their own or through the help of a trained counselor. And here are some of the components of Thrive Hub. One, it's a single sign-on system. So you have one sign-on. There's not multiple systems that you have to sign on to. It is secure and HIPAA compliant, but it's also an efficient way, as Rowan said, sort of access those multiple benefits in one single platform. So if they're applying for SNAP, that application is submitted directly to DSS. If they're applying for Medicaid, it's submitted directly to DHHS, all in one interview without having to go to 4 or 5 different agencies to get those needs met. Within Thrive Hub, there are several components. One is Find Good, and that's where the majority of the work is being done through our benefits counselors. So they can help a senior apply for those benefits that we talked about. That data is shared between providers so that communication continues to happen. That's where the document repository is as well, so they can upload those documents in and save them for the next time that they have to recertify. One of the great things too is we've just entered into an agreement with DSS to be able to do recertifications. So that helps. So in 3 years, when say that ESAP senior or that senior that's receiving ESAP benefits they have to reapply or recertify, all that information is saved into the system. So they don't have to go and look for those other documents. What a great thing is also we have closed loop referrals. So, I have my go-to organizations that I know that I refer to all the time. I can go into Thrive Hub, assign a referral to that particular agency. That agency picks it up and they communicate back to me that that senior was contacted. They made their appointment to be able to pick up a food box, and then that loop is closed. But say I don't know where to find, say, the nearest food bank or the food pantry, I can post what's called a service request. And so in that service request, that can be sent out and say, I need food, right, for this particular client. I can send it out to 5 different agencies and one will pick it up, and then the loop is closed as well. So that service request will be closed once that agency picks it up. And again, that communication still remains. So the agency that picks it up, they communicate back to me or to the referring agency. We have resources available, because the worst thing is to refer someone to an organization and they don't have those resources available, and then they get frustrated and they just drop out of the process altogether. With that service request, you can send it out to multiple organizations, and then that one agency can pick it up and let the referring agency know. Other things within Find Good are like shared workspaces, so that collaborative communication back and forth. The benefits and referral specialists at the councils on aging, they can make case notes, they can do a social determinants of health screening on their particular seniors. So again, finding out what transportation barriers are there, does that senior feel safe? They can document there if there are food security issues, or if there are issues with, like repairs or things like that, or even that senior doesn't have any health insurance, they can all disclose that on what's called the social determinants of health evaluation matrix. And we can track outcomes. You can monitor that senior's progress on a timeline and also get reports. Within our search directory, we have the ability to search by category. So just like you would do a Google search, you can use Thrive Hub to do your search directory to, again, see where the nearest food pantry is or the food hub is, see where the housing resources may be. You can search by zip code or by category. And we're working on the feature now where it will be public facing. Currently, right now, it's for our partners who have access to the system, but we are working on that public facing feature. And then just looking at the numbers. So last year, we served over 10,000 seniors with application assistance. We completed 3,036 SNAP applications for people over the ages of 50. And so our seniors are identified as those ages 50 and older because of some of the other grant requirements that we have. But we did 3,036 SNAP applications and 5,310 ESAP applications for those that were over the age of 60. And so what we do in our contact center, we ask our callers, how did they hear about us, and was this service helpful to them? We have in that sort of survey, informal survey, seniors have disclosed to us that they feel that people are out there that don't and cannot afford food, right? And that affects their health outcomes, and that having food to eat for them is a big deal. Another client disclosed that they noticed that people do need SNAP, and that it's wonderful to be able to have someone who cares about them and to help them along the process if they're not able to complete the applications on their own. I love it that one person said that it's a good way for them who don't have transportation, but that they feel that they are important. They have a voice, that they're not just a number. That's important to us. And so as we go through that process of helping individuals, we make it as simple as possible so that, again, they're getting quality customer service, they feel valued, they feel like they have a voice. And I love that the senior said that we seniors need the help. So, Rowan, I think I'm gonna turn, one more thing, as far as our impact overall over the last few years. So we've completed over 294,000 applications. That's for SNAP, Medicaid, TANF, taxes. We're in tax season currently, and a large percentage of our tax clients actually come to us who are seniors. And so we offer free tax assistance in the Trident area and around the state. And with all of those benefits, we've brought back over $740 million to the state of South Carolina. We're pretty proud of that. I will do a shameless plug and say, for you and your staff, if someone's preparing to get their taxes done, don't pay, they can come to SC Thrive. So with that, Rowan, I'll turn it over to you.
Thank you, Stephanie. So with all of that, these are our three asks. Our first ask is for communication support. We have a couple ideas for some projects to really promote our initiatives. I think both of our agencies are doing a lot of work, but there's some barriers there that I talked about. And I think our projects will kind of help with those barriers because we have the technology piece and we have the outreach piece for sure. We're communicating with a lot of seniors, especially in the areas most in need. But we do need to really look at a more comprehensive SNAP training workshop for those individuals like counselors or caseworkers or information referral specialists, whoever it may be, who are actually assisting with the applications, because there are so many bits and pieces to those, to the SNAP application to really maximize the benefit. So a full understanding of what those pieces are to better educate the senior and to really help them get the most bang for their buck is needed. But we need to set up a training process and making sure that it's up to date every time something new comes out, basically. And then, of course, along with that, some kind of toolkit to explain all the intricacies of that application and what the different pieces mean. We're also looking at the marketing aspect for SNAP. Something more innovative to encourage eligible individuals to apply. Something not so snappy or food stampy, however you want to call it. Some states are, doing things already. So we want to see what other states are doing and find some more creative ways to pull in interested individuals and really kind of rebrand it, I would say. Some states have looked at rebranding the ESAP and focusing on it as a nutrition program for seniors and not so much food stamp idea. Another piece of that would be looking at developing effective messages and materials for the Hispanic and Latino audiences. As I mentioned, for our grant, our small grant that we were working on and still working on, we weren't really focusing on that that population group, but we want to. And SC Thrive already does have some tools for Spanish-speaking individuals. So we want to tap into that and expand that. We'll look at that more. I'll let Stephanie talk about our next ask, which is professional development.
Sure. And so just briefly, we host an annual training every year to help our partners and other community health workers, healthcare providers, food bank volunteers understand what are the best practices in helping and serving seniors. And so this past year, we had a specific senior related tract of classes that helped, again, those business professionals or those nonprofit professionals learn more about SNAP. We had experts in the room from DSS to talk about SNAP policy updates and things like that. And that class in and of itself was one of the highest attended sessions that we offered. And so that told us people want more. They want to know more about what resources are out there to help seniors. What can they do in their organization to bring these resources together? And so your endorsement, Healthy Palmetto's endorsement of this training can help bring more people to the table to share what they have done, but also, again, just provide that professional development amongst their peers.
And then our last support request, Stephanie, I'll probably both talk about this together, would be the financial support, because training programs and toolkit and marketing aspects all cost money. So really what we're also looking at is other entities joining us. We don't see this as being just Department on Aging and SC Thrive. You know, other entities would have to join us at this table to really make this a statewide cohesive message and process. So Stephanie and I have already talked about some of those groups already that we would probably like to bring to the table. But we're also looking at, you know, looking at that marketing material and having it be co-branded so that other organizations can kind of make it their own as well, like put their own information on there, but have a statewide kind of feel and brand to it. And then of course, Stephanie had discussed the professional development conference as a piece of the whole ask. And for all of these different things that we're looking at, we are requesting $20,000. So with that being said, Stephanie and I, you know, we're happy to take any of your questions about what we do or where we want to go next.
Thank you, Rowan and Stephanie, so much for your time and for your presentation and just all the work that you're doing in our state. Rowan, if you wouldn't mind hitting your stop share button and we can move to discussion. So I know we started a few minutes late because we're coming off of the last presentation. So to our Leadership Council, if you don't mind giving our presenters an extra 5 minutes or so after 12, we just want to make sure that we have enough time to discuss their presentation, the priority that they presented on today. So I will open it up to the group. A reminder of our questions from Lori, which is, what are you still curious about? And what ideas did this generate? And I can ask the first question if you guys don't mind answering. So I have a question I'm curious about. So your opportunity for getting trained for SC Thrive and using the hub and helping seniors get enrolled, is that specific for, do you have to have a certain credential, or could like a community member get trained to help seniors enrolled in SNAP? Just thinking about coalitions getting involved in this work. And I was just curious if that's something that was available to them as well.
Sure, that's a great question, Kelsey. Thank you for asking. So community members could definitely get trained to use Thrive Hub to help. We want anyone to help as possible, but we do want them to be affiliated with an organization to help sort of that accountability. So whether if it is a coalition, as long as that coalition has a decision maker that says, you know, I vouch for this particular community member, and they will sort of be working hand in hand with our organization to make sure, you know, we'll do the background checks and the screenings and make sure that they, you know, have all of the training and they're vetted for compliance. But again, we do want that connection to an organization.
Gotcha. Thank you.
Absolutely.
Hey, Stephanie, I know we're talking about state level support for the initiative, but I was wondering when you showed the map of the different regions and some of the things that are going on at the local level, is that information that we can find on the SC Thrive website?
So yes and no. The slide that had it in this presentation was from Rowan and the Department on Aging and what they're doing, but we also have a similar map of the areas that we are serving with the counties. Does that answer that question, Erica? I think.
Yeah, and Lori and I were just texting some brainstorming ideas to each other while y'all were presenting. Light bulbs were going off, so we may be back in touch with
Awesome.
y'all for some specific communities.
That sounds great. We definitely welcome it.
Hi there, Sarah Wilcox. There are, I guess, two groups of professionals that I wonder how much you collaborate with. I was really struck by this idea that, we do tell people to be really careful and to not just go online and fill out forms, and older adults are taken advantage of. And so I guess I was wondering about both primary care doctors or doctors in general because of older adults, frequent visits to them. And the other group I wondered about for the more of the training side were librarians, and whether they've been involved in in your work and helping. Yeah, I just think about them as really wanting to help people get access to things.
Yes, I will talk very briefly. Rowan, you may want to jump in too. So I'm glad you said librarians. I didn't even think about that. We have worked with libraries, gosh. So I've been with the organization for 7 years. So I know at least for 7.5 years we have, and they are doing some amazing work now with really being sort of that community navigator or that community, what I call health worker. So we are partnering with almost, if not at least one library in every county. I know that we have a large network of libraries that do support our services. Some of them don't have the capacity to do the actual applications, but what they're currently doing is they're recruiting, I think, students and things like that to help assist with the applications. And then with the providers, they don't have the capacity per se themselves to doing the applications, but they do have like their outreach teams. So we're currently working with the FQHCs that has their outreach staff completing applications, as well as there's an organization I know up in upstate, a network called I think it's Care Well. They specifically focus on seniors, and so Center Well. And so we have all of our materials related to SNAP and the other healthcare related senior focused programs. They have those materials that they hand out at all of their Care Well centers all across the state.
Great, thank you.
Mm-hmm.
Wonderful.
Rowan, did you want to add anything to that?
I was just going to say that the Department on Aging hasn't been working with the libraries as far as like SNAP, but we do have a relationship with them in general. So this is just another thing we can do with them. We've been looking at more like social isolation projects. So I think this is a great idea to connect more on this topic. So thank you for that.
I'm Cherie Muse. I'm with AARP South Carolina, and we have partnered with both Department on Aging and SC Thrive. So we know the great work that both of you all are doing. As you were talking, I really found helpful the stats that you shared about the pilot project that you did. And those were people who ultimately ended up enrolling in SNAP, correct?
We don't know exactly if they enrolled because we don't find that side of it. We just know that they got assisted with the application process.
Okay. Because for me and AARP, that would help us to target our list. We do a lot of promotion of SNAP and SNAP enrollment and access, but it would give us some metrics to kind of tag our stuff on, hang our efforts on. So I thought that was good. And then I love the question. I think it was Kelsey that asked whether or not community people could be trained to help, because we have such a huge core of volunteers that love this kind of thing, and they're the type of people that could be trusted to do it and would want to do it. And we're always looking for opportunities to present to them. So I feel like we may be able to connect on that too.
I am excited about that, Sheree. Please, let's talk.
Yes.
Because we have trouble finding, honestly, volunteers for our partners. So our partners, they would love to have more volunteers, but they don't know how to reach them. So that would be a great way to connect. Even if it's not a coalition, maybe we can find a partner that is closest to them that they can connect to help more seniors. That would be awesome.
Yes. A win-win. Great.
Absolutely. Yes.
And I'll just say, I think I saw light bulbs go off with Kelsey and Lori too. We just finished talking to WIC, and I had mentioned that, we have a lot of grandparents that are influencers in their children and grandchildren's lives. And then your Help Me Grow SC component, I wondered whether or not we might be able to even tie in plugging WIC. You may already do that, but sharing WIC information with grandparents too.
That is on our list. I do know that. So yes,
Good.
so let's also talk about that, how we can
Perfect.
totally align, because we are serving the same demographic.
Yeah, one point, Stephanie, when we're talking about these now 8 priority areas that Healthy Palmetto is getting behind trying to advance, I think we're going to see more and more of, making sure we're making the connections across those as well. So exactly like Sheree was saying, WIC, like is WIC one of the services y'all refer out to? And if not, how do we create that connection? Same thing we heard from a group that's working on trails in South Carolina and developing this database of walkable trails in our area. And so, how do we see if there's an opportunity to, if y'all already have a system of, plug somebody in and they need physical activity, how can we make sure that they're connected to the trails that we're developing this database for? So I think over the next year, we'll start to see more and more connections like that of things that you're already doing that we can just maybe make connections to see how we can like maximize what we're doing.
Absolutely. I love that. And I would just love to just sort of pose to the group that I just wrote down trails. So we need to have trails on our search directory. I never would have thought of that. So that would be another way of any resource that the coalition, where it may not be in this particular segment of the 13 initiative, core focus areas, please let us know. We want to really just put as many resources in the search directory as possible. So thank you for that.
Yeah, the Department on Aging has a resource database as well. So we can definitely put any of that type of information on our side as well. So yes, that's wonderful.
Great. Well, any last thoughts for our presenters today, for Rowan and Stephanie? Any last thoughts or questions that they can answer for you?
I don't want to monopolize, but I'll just say, Stephanie, I'll be in contact. Rowan, also the piece about the communications and the marketing campaign. I just don't want you to think your ask fell on deaf ears. I'm thinking through how we might be able to pitch in on that too. So I'll reach out and see what a good starting place is for that.
Sounds great. Thank you all so much.
And then I think I heard y'all say that y'all weren't through your pilot anyway. You were not reaching Spanish speaking seniors. And so Elizabeth's here from Pasos, and I know they have so many connections. And so any of those kind of things that bubble up, we are having a leadership council meeting on Thursday of this week where we're going to sort of process and digest all of the presentations we've had last week and this week. And so we will be back in touch with y'all with the next steps and, how we can best assist you going forward.
That sounds great. I will say Pasos is in our building, so they're on our list to get as much information as possible from you.
Thank you so much. We really just appreciate the opportunity to even our ideas. So thank you for that.
Absolutely. Well, we are grateful for your time and the work you do. And thank you to our Leadership Council for your extra time this afternoon. And we'll see you one more time at 1 o'clock, I think. So we'll talk to you all soon.
Yeah, you're breaking up just a little bit, Kelsey.
Oh, sorry, I was just
All right,
wrapping it
Leadership
up.
Council, we see you at one more this afternoon. Thank you so much,
Thank you
Rowan
all.
and
Have a great
Stephanie.
day.
All right.
Thank you.